Ebola in the Democratic Republic of Congo is declared an international public health emergency. That alarm from the World Health Organization. So given the resurgence of the disease, has enough been done to stop it? And can science one day wipe it out? This is Inside Story. Hello and welcome to the programme. I'm Imran Khan. It's the largest ever outbreak of Ebola after the 2014 epidemic in West Africa. And the spread of the virus in the Democratic Republic of Congo has reached a critical point. The World Health Organization has now declared this latest flare-up a public health emergency of international concern. That rare move could boost global attention and encourage more aid. Almost 1 year into the crisis, more than 2,500 people have been infected in the region and at least 1,600 have died. The first confirmed case in the city of Goma. It's a major regional hub on the border with Rwanda, and that's raising concerns the virus may be spreading beyond the DRC's borders. Catherine Soy reports from Nairobi.
After hours of deliberations by the Emergency Committee of the World Health Organization over the status of Ebola in the Democratic Republic of Congo, members have decided it requires a vigorous international response.
There is concern about spread of Ebola from Goma, the getaway, even though so far no cases were newly infected in this city. 2, there is disappointment that there has been a recurrence of intense transmission in Beni, so that the geographical expansion is now some 500 kilometers. 4, the fight is ongoing for a full year now.
The meeting was called after a preacher who had traveled to Butembo, about 200 kilometers north of the city of Goma, to pray for the sick, tested positive on his arrival back. He died earlier this week. At the border between Goma and Rwanda, health workers are taking no chances. Rwanda has already told its citizens to avoid traveling to Goma. The WHO committee has, however, warned against closing borders and restricting trade. DRC government officials say many of those who came in contact with the preacher have been vaccinated, and it's unlikely Ebola will spread further. But there are still concerns. Goma is a key city.
I can't afford to be afraid, because if I'm scared of carrying someone, I'll get no clients, and that means no money. So what shall I eat?
What will we do now? Shall we lock our children because of this? I'm very worried.
More than 1 million people live here, and sitting at the tip of Lake Kivu, it's easy to travel to other countries in the region, as well as other parts of the DRC. Vaccinations in affected areas have intensified. This is Beni in North Kivu province, where there is concern that more people are getting sick. There is also concern about the disease spreading to Uganda. Health workers in southwest Uganda are vaccinating people who could have come in contact with a Congolese woman who visited the busy Mpondwe market to trade a few days ago. She died of Ebola when she returned home. The government says she did not cross at a formal border point where she'd have been screened. This is the same region where a child tested positive for Ebola last month after his mother took him back to DRC to bury his father. The child later died, adding to a death toll of more than 1,600 in the past year. Catherine Soy, Al Jazeera, Nairobi.
Ebola got its name from the Ebola River in the Democratic Republic of Congo, where the virus first appeared in 1976. The latest outbreak there started in August and is the 10th in more than 40 years. Last year, one that lasted from May to July killed at least 33 people. And in 2014, at least 49 people were left dead. Separately, the outbreak in West Africa between 2014 and 2016 claimed the lives of more than 11,000 people. Back in 2007, more than 180 people were killed. 12 years earlier, at least 250 died in a major outbreak. Let's bring in our guests. Joining us in Geneva, Mercedes Tete. She is the International Medical Secretary at Doctors Without Borders. In Lancaster, Derek Gatherer, a virologist and a lecturer at Lancaster University. And in Beni, the Democratic Republic of Congo, Ghislaine Muhiwa, a community organizer and member of Struggle for Change civil society organization. Welcome to the program to you all. I'd like to begin with Derek Gatherer in Lancaster first. The WHO, the World Health Organization, have called this a emergency that is of international concern. It's a rare move by them, but this has now been going on since 1976. And a lot of people have asked me, and I'd like to ask you this question. Perhaps it's a little naive, but how come we haven't vaccinated this disease away? We've known about it for decades.
A vaccine was developed in the 1990s. There was a lot of concern at that time about the potential use of Ebola as a biological weapon or its use by terrorists. So the United States developed a vaccine in collaboration with several other countries. And then that vaccine more or less lay unused for 2 or 3 decades, even until the big outbreak in West Africa. And it was only then that the vaccine was taken out of the freezers and brought up to production standards. So now, fortunately, we have a vaccine which is able to be used in these kind of very large outbreaks. But the reason why we didn't do this before was because Ebola simply wasn't regarded as big enough a problem prior to the big outbreak in West Africa in 2013 to 2016.
So why has it become such a big problem now?
That's a very interesting question. We don't really know. There's no indication from any of the studies of the virus genome that anything has changed in the Ebola virus genome that's making it more infectious in humans. It doesn't seem to have mutated in any significant way. So we're looking at a virus which is fairly similar to the virus we've had in 1976 and since then. And yet there seems to be more opportunity now for Ebola to spread within human populations. It might be because there's greater population movement, that perhaps people are coming into contact more often with animals that may be the hosts of Ebola virus. And in particular, we think that bats may be the most important host of Ebola virus, perhaps through the eating of bushmeat and things like that, that contact with animals in the forest areas is giving more chances for Ebola to cross over from its animal reservoir into human populations. And where human populations are very dense, as we see in West Africa and also in this part of eastern Congo near the Great Lakes region, which is one of the most densely populated parts of the DRC, it means that once it gets into humans in those kind of areas, it can really take off and produce a widespread outbreak.
Let me bring in Mercedes Tete here, who's from Doctors Without Borders. You recently were in the Democratic Republic of Congo. Just take us through what you saw there and what the challenges are for an organisation like yours trying to combat this disease.
Well, the challenges are major, but what is for sure is that today, 1 year into the outbreak, the health workers are still being infected and community deaths are happening and transmission is ongoing. It is clear that we need a shift and a clear gear up in the response, and we hope that this declaration represents a major call for a qualitative reset in the response.
Let me bring in Ghislaine Muhiwa here in Beni in the Democratic Republic of Congo. You are there, you're a community organizer. From what I've been reading, from the people I've been speaking to, one of the reasons perhaps that the outbreak has taken place is because many people were very suspicious initially of the vaccine to begin with. They were very suspicious about what it might do to them. Is that something that you've heard from people, from your community?
Yes, in Congo there are many difficulties about Ebola outbreaks, and I think the first is it was about the strategy which was implemented when the outbreak began here in Beni, and especially in Mangina, because there were many strangers, so people from other countries and other cities, they came here in Mangina, and local population saw that like it is not an outbreak, but like a business for people. They came here to gain money, and that was one of the great challenge what we met in the fight against the outbreak Ebola. And another one is it was also about the perception, how people trust that Ebola exists. So there are many people, even if leaders from religious, from civil society, they don't trust that Ebola exists. And it was also one of the challenges. But in the time and according how the report team was working, things are changing. And today we have those people who trust that Ebola exists because we saw some of our brothers, some of our sisters who died from Ebola. And it is really, really a great challenge for people. And the awareness is high than at the beginning. And that's why I think is today a moment for those team who which works in the Ebola outreach to multiply strategies and sensitization from all the country or the community to see how people can commit again in the fight against Ebola in the Democratic Republic of Congo.
Let me bring in Derek Gatherer here in Lancaster. It was an interesting answer to a very straight question. You know, there was suspicion. We've managed to get over that suspicion and people are now taking the vaccines. But this is a question more about strategy to you. It seems to me that the strategy is ring vaccinations. That is, you vaccinate the first person that came into contact with Ebola and then vaccinate everybody who has come into contact with that person. Why not just vaccinate everybody?
That would be what we would call a mass vaccination programme, and it would require far more doses of vaccine than we currently have. We've given out about 160,000 doses over the last 15 months or so, and on average there's about 100 individuals that are identified as candidates for ring vaccination from each case. So it's usually about 10 contacts and then about 10 more contacts for each of those contacts. But one thing that the Public Health Emergency of International Concern declaration might do is it might stimulate governments of rich countries to put money into subsidising vaccine production, because if we are going to move from ring vaccination, then hundreds of thousands of doses won't be enough. We're going to need millions of doses. So, for instance, in the city of Goma, where there's a case arrived earlier this week, which caused some considerable concern, that there's 2 million people there, and we would need 2 million vaccines just to make sure that everybody in Goma was vaccinated. So perhaps now that the WHO has made this announcement of a public health emergency, we will get more vaccine produced, and we might be able to move from ring vaccination to a mass vaccination programme, just as we do for many other diseases in Africa. Yellow fever and measles, for instance, are the subject of mass vaccination programmes.
Mercedes, do you agree? Do you think it's time for a mass vaccination programme?
I think it's time. The ring strategy, the ring vaccination strategy is been nevertheless limited due to the fact that contact tracing and identification of cases has been far from optimal. It means that we have to move away from an ideal scenario where a ring strategy, vaccination strategy would be sufficient. Today it is proven that it is not enough. In that sense, we are really very much interested at participating and collaborate with the DRC authorities for a broadening vaccination strategy with multiple approaches that really correspond to the context. We cannot be doing more of the same. More of the same did not manage to reduce transmission up to now. In that sense, we really welcome, and we think that's part of this stepping up and multiplying, tailoring responses, which will prove more efficient than what it is done up to now. Just wanted to add that for any vaccination strategy, what it is fundamental and essential is for the community to own this response. Therefore, having the choice regarding vaccines, vaccination, and also the care that is proposed to them.
Well, that's an interesting point. Let me bring in Ghislaine from Beni. Our guest in Geneva is saying that the community needs to do more. It needs to own this program itself. There needs to be much more awareness. Would you like to see a mass vaccination program amongst members of your community, or would you rather see the strategy that as it's going on at the moment, this idea that we only vaccinate people who have caught the disease already and those people they've come in contact with?
Sure, it's a good strategy because when they explain the meaning of that strategy for people, it works. But to have those difficulties, even if those teams which are working in the vaccination, people are not accepting to be vaccinated because they have some untrust ideas, stereotypes about vaccination. Some of people thought that vaccination is have some consequences in the future, and so if you use it, and because it is an experimental vaccination, you can get some difficulties in your future, and so people are not agreed to be vaccinated. It's one of difficulties those teams are facing on. But when the outbreak is taking a high level, people are whining about the situation, and some of them are able to come at the vaccination place and ask for vaccination because they saw that it is one of good strategies. And even if it is not total, or even if it is not the best or the great strategy, it is one of strategy which can work to overcome Ebola. And so it is very, very important also to say that there are other strategies I think it can work, because we can't overcome Ebola without work with the community. And that's why the sensitization on the community and to get the commitment of the community is very important for the struggle against Ebola. And I saw some teams of repost are working on that to see how we can get the commitment from the community, and also how we can help those vaccination teams to do very, very good their work. And in Beni and in Butembo and other places where Ebola is, things are working today. It is not limited as at the first time, because at the first time it was only for a small category of people. But today, all people are invited to be vaccinated, and that is one of the great things which evaluated in the situation and in the struggle about.
So that's one strategy that has worked, bringing in the community. It's a very important strategy. I just want to ask a question to Derek in Lancaster. As a virologist, this question comes to you. The declaration that this is of a public health emergency of international concern is very good for awareness, but how about actual action? There's a lot of concerns that it might be toothless, that they're not actually doing anything, everything that they could be doing to stop the virus. The virus doesn't have any borders, clearly. And there is a concern that maybe neighboring countries in particular, will just isolate the Democratic Republic of Congo. And that's a concern to the WHO as well. Should we be isolating the Democratic Republic of Congo?
I don't think it would be possible, even if it were desirable, to attempt to isolate a country like DRC. There are many people that cross the borders with the neighbouring countries multiple times in the course of their daily lives. And there's been an astonishing 75 million temperatures taken at official border crossing points. Now, that's not 75 million different people. That's it's probably rather fewer than that, but it reflects the number of border crossings that we see every day. And of those 75 million readings that have been taken, 21 of them have turned out to be positive for Ebola virus at some point or another during the last 15 months. So those are 21 potential cross-border transmission events that haven't happened because they've been stopped at the border with the temperature monitoring with the optical thermometers. And so far we've only had one case, the one that got into Uganda, that was confirmed to have actually crossed the border. So this is quite a good strategy for preventing Ebola from getting out into neighbouring countries. It's not foolproof, of course. There's an enormous volume of traffic at the borders. Yesterday on Al Jazeera you were showing some footage of how busy those border crossing points are and how difficult it is, the amount of work that people that are doing temperature monitoring have to do on the borders. But so far it has worked quite well. So I think that it's definitely not going to happen that we'll isolate Congo, and it's not desirable for the economic development of this part of Africa that we should do so either.
We are running out of time, but just very quickly, I want to follow up that question with you, Derek. Yes, it seems to be a success at the official border crossings, but there are a number of unofficial ones. In my colleague Catherine Soy's report, we saw somebody who'd managed to get across the border, and they got across the border at a place where they weren't checked because it was an unofficial border crossing. That's a concern, isn't it?
Yes, it is also a concern that people are using unofficial border crossings, especially people that may be concerned that they have a fever and would therefore not be permitted to get across and might end up in an Ebola treatment centre while the cause of their fever was ascertained. But isolating the border, the official border crossings and cutting them off would just make it more likely that people would use unofficial crossings, and then we would have very little control at all over who was crossing these borders. So that's something which is probably disadvantageous. One strategy that has been used is that medical centres close to borders have had all of their staff vaccinated. So many medical staff in Uganda and in other neighbouring countries that have been vaccinated in preparation for the likelihood that an Ebola case will arrive at their medical centre. And there's a great deal of work being done in preparing medical facilities where they exist in areas near the borders and in cities which are close to the borders in anticipation of cases getting through. And in fact, the case that got through in Uganda a few weeks ago didn't result in any more spread in Uganda because the preparation in Uganda was actually quite good, and they managed to catch it and deal with it fairly quickly.
Mercedes, we are running out of time, but I would like to end with you. Should we be isolating DRC, or is there another strategy that will work better?
Well, it's obvious that it would be impossible, as my colleague said, so I don't think we have to spend much time, and much on the contrary, it can be absolutely counterproductive. Restriction measures, restricting movements and coercion measures can only increase mistrust from the community, and therefore for the affected communities to be, on the contrary, far from trusting the care that can be provided by the medical teams and the response for the outbreak. So I would say very strongly that it's not conducive and counterproductive in our point of view.
I'd like to thank all our guests, Mercedes Tete, Derek Gatherer and Ghislaine Muhiwa. And thank you too for watching. And you can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. And you can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Imran Khan, and the whole team here, bye for now.